So, the first thing I'm going to do is I am going to identify the client. And I'm going to identify the client by asking him his name. So, sir, what is your name?
Pioquinto.
And then I'm going to proceed explaining the procedure to the client. So, first is, sir, I'm going to inspect your external ear. I'm going to use a pen light to look for any lesions or any abnormalities. And then I'm going to move on to palpating your auricle, which is this part po. So, I'm going to start doing that. Can I have your permission po? And then I'm going to start inspecting. I'm going to inspect the tragus, the lobule, and the auricle. And then I'm going to look, and as what I said, I'm going to look for lesions or any abnormalities. So, sir, I'm going to start palpating it. I'm going to palpate your mastoid process and your tragus. So, sir, can I have your permission? And then I'm going to do the test. So I'm going to, sir, can I your ear? I'm going to hold the auricle and then I'm going to pull it up and push it back. And if there is any pain, then that means po, have you experienced pain po? So if there is any pain, that means that there is some kind of infection. And then I'm going to proceed on inspecting the internal ear structure. So inspecting the internal ear structure, I am going to use the otoscope. So I'm going to start with inspecting the external auditory canal or the ear canal using the otoscope. So I'm going to do this action. So I'm going to hold the auricle, I'm going to pull it out and back. Then I'm going to use the otoscope to inspect it. So I'm going to note the consistency of the cerumen, and I'm going to observe the color of the cerumen that I am looking at. So then I'm going to continue doing that and I'm going to inspect the tympanic membrane or the eardrum, and I'm going to note the color and the shape of the eardrum and look if there are any abnormalities. Doing the whisper test. So I'm going to ask the patient to cover one of his ears, and I'm going to whisper a 2-syllable word behind him, and I'm going to ask the patient to repeat it. So, sir, can you cover one of your ears po? Ganito. So you're going to repeat what I said po. So,
Popcorn. Popcorn.
and then kabila naman po.
Popcorn. Popcorn.
And when the whisper test is done, I am going to move on with the Weber's test, where I am going to use an equipment, a tuning fork. So I'm going to strike the tuning fork, and then I'm going to place it in the patient's forehead and ask the patient which ear has better hearing. So, sir, I will put this on your forehead po, okay?
Okay.
And you're going to tell me which one is mas malakas yung pangdinig. Wala pang na. Again.
Right.
Okay. And then I'm going to perform the ring test. I'm going to strike the tuning fork and then I'm going to place it this time on the patient's mastoid process, which is behind the ear. So, and I'm going to ask the patient to tell me when, if the sound has, if he hears no sound, or if the sound stops. So I'm going to strike it. Okay, kabila. And then I'm going to proceed to move on with the Romberg's test, which is I'm going to ask the client to stand with feet together, arms at sides, and eyes open then with eyes closed. To move on to the Romberg's test, where I'm going to ask the patient to stand and look if the patient can balance himself. I'm going to ask the patient, so sir, can you stand po? And I'm going to ask the patient to close his eyes. So sir, stand straight po. Now you can open your eyes. Okay, so yun lang po. Upo na po ulit kayo. So the Romberg's test aims to look for the check the patient's equilibrium or balance. That's all po for ear assessment.